Well, time to check in with infectious disease Dr. Zain Chagla for the last of his weekly visits with us. He is going to be on every month going forward, but I guess that's a sign, Dr. Chagla, of how far we've come in the COVID pandemic.
Yeah, I mean, absolutely. It's incredible. Talking 2 years later, we have so many tools. We, have a good chunk of the population vaccinated. We have therapeutics. Yes, there is a problem still in the community of transmission, but it is much, much more stable than it was in prior times. And it's just a miracle to think about what's happened over the last 2 years and really how much we've discovered and been able to control this disease moving forward.
In fact, there's just a new study out in The Lancet that shows that researchers estimate COVID-19 vaccines prevented 19.8 million out of 31.4 million deaths.
It's incredible, right? And I was at a seminar last night and we talked about, if we remember in the third wave how bad things were in long-term care, but vaccines went in. They were the first population to get vaccinated, and long-term care outbreaks just dissolved overnight.
Yes.
People didn't die in long-term care, despite the worst of what was happening in the community. ICUs being filled, long-term cares were safe, and it really does talk to the power of these vaccines and what they've done to keep us safe moving forward.
Moving forward with the monkeypox virus, there's a vaccine program for that now moving forward. And I understand that the WHO yesterday was set to meet on, are they going to declare this a global health emergency?
Yeah, I mean, look, there is uncontrolled transmission that is occurring in multiple countries. It's likely lots more than under the surface of cases. There's, issues with detection and testing. There's issues with prevention and access to vaccines and therapeutics. This is really fitting many of the definitions of a global health emergency. And it isn't COVID over the last few years that's been there. It's been Ebola, it's been Zika, it's been other infections that have had, minimal impacts outside of one major population. But it does tell forces to mobilize. It tells people to start, working together collaboratively and to really recognize that this may be here for some time, and efforts need to be put in place to make sure it stays stable and the highest risk populations are protected.
Speaking of other viruses coming forward, there are new cases of polio in the United Kingdom.
Yeah, this is really concerning, and and it's been reported as well in Israel in the wastewater sampling that polio has been noted there. Now, occasionally the oral polio vaccine can reinfect individuals after, but it is very effective and very easy to give. But it is of concern. There is probably some people that missed out on their childhood immunizations. There are people that are not getting immunizations for a number of reasons, and that herd protection from other people being immunized may break down if we see local transmission finding individuals. So, it is important for people who have missed their immunizations. These diseases may be coming back, and we do have to be cognizant of that. Staying up to date is important. And again, if you haven't initiated the series, now is the time.
Right. And is polio, just quickly, is polio one of those vaccines that's still given in childhood? Or I thought we had reached the case where there was no more polio almost at one point, and I assumed that they had stopped giving the vaccines.
No. We do give the inactivated polio vaccine in childhood. It's part of the normal childhood series, and so it's important. It's just, it's given in combination with other vaccines. And so if you're missing those vaccines, you're missing that protection as well.
Okay, Dr. Zain Chagla, always great to see you, but it's good that we're not going to see you as often. That means the situation's a little calmer now. We will see you next month. Thank you.
Take care.